Hi there, Alex Devillarius here from Perth's most awarded dental practice, Sparkle Dental Joondalup. Today I want to talk a little bit about wear and dental erosion. In dentistry today, our knowledge of this condition has really exploded in recent years. You know, back in the day we used to think it's all from patients grinding their teeth and everything else in terms of that's what's causing all the wear of the teeth. But our knowledge today is that a lot of the wear and erosion and the damage to patients' teeth that we're noticing is due to acid. Now, vast majority of patients are completely unaware of in terms of what's going on. And the difficulty from our end is when patients say, you know, doc, does it seem like it's changing? Is it getting any worse or whatever else? Because from a patient's point of view, there's no pain. So patients, you know, and these, like everything that happens slowly, given enough time, when we look back in time, there is a big change. So, you know, what we used to try to do our best every 6 months and seeing our patients, we'd really look and try to analyse, but there really is a lot of deficiencies in terms of how we used to do that. We take a lot of digital photography here at our practice, but even that, it's been limited, and, you know, we used to get stone models with impressions and things like that, and just trying to get an understanding of, is this changing, is this getting worse? But now, thankfully, with the digital tools that we now have, we can get answers for this. It's called patient monitoring. Now, the way that this happens is we get a digital scan of our patients' mouths. Now, the beauty of these scans is they're so accurate. They're between 7 to 40 microns, which is extremely accurate. And then what we're able to do is for our patients that we feel are at risk from acid or grinding their teeth or have airway obstructions and things like that that are causing this gradual chronic wear of their teeth, what we do is we can do a sequential scan in, say, 6 or 12 months' time. And what the software does, it merges those two scans together. And what it's able to do is to give us a heat map. And in that heat map, we can actually determine exactly to the microns what's changing and what's not. So what it allows us to do is to get a very, very clear picture of what's happening in our patient's mouth, being able to educate and inform our patients in terms of what's happening, because, you know, because this is a painless condition, patients have no idea that this is happening, and then we can be very preventive, conservative, and try to get problems early, because if there is a problem, because it makes our treatment and our options for our patients a lot simpler. Hope this has been helpful. Please feel free to call us anytime by our very friendly team, and I look forward to seeing you in the future. Thanks so much. See you next time.